So today it's my pleasure to interview Dr. Derrick Rossi, one of the co-founders of Moderna, who pioneered the mRNA technology that is used in the Pfizer and Moderna COVID-19 vaccines. I'm very grateful to Dr. Rossi for being part of this episode. So Dr. Rossi, you're a world famous scientist and entrepreneur and an early pioneer of mRNA technology. Times Magazine named you as one of the 100 most influential people in 2011. With such a successful career, and once again, you made a lot of big changes in our society. Can you tell everyone about your educational background?
Sure. Well, pleasure to be here. So I had a long, winding path through education. I did my undergrad. I'm Canadian. I did my undergrad at the University of Toronto, and then I did a master's degree there, which could have been a PhD because I was sort of in the PhD program, but I instead moved to Paris, France, and I entered a PhD program in Paris, France, which I was in for about a year before not completing that PhD, second PhD. And then I moved to Texas. I was at UT Southwestern Medical Center in Dallas, Texas, doing research there. And then I moved to Helsinki, Finland, where I entered yet another PhD program, and I completed that PhD. And then I did my postdoctoral training at Stanford University in the Bay Area. And then I took my faculty position at Harvard Medical School in 2007. And I was an associate professor at Harvard Med until a couple of years ago when I retired from academia.
Okay, so I have a follow-up question is, so you said you went to Finland to pursue your PhD instead. So why did you go to Finland, that location, instead of going to somewhere else?
Well, I was basically I was pretty interested in traveling the world. Let's put it that way. And I had an opportunity to move to Finland when I was a young person. I didn't know Finland, and I wanted to go live in Finland and explore Finland. I did not necessarily know that I was going to complete my PhD there, but I did know I was just going to go and explore life in Finland. So that was kind of my motivation. In the end, I did a lot of science, published a lot of papers, and got my PhD there. But I was more following the muse of traveling around the planet. I also traveled through Europe many times. I traveled through Central Africa. I liked exploring the planet as a young person. So that was just part of that.
Okay, so I noticed in your bio that you're very interested in molecular biology in high school. So there's got to be a story behind that. Why are you so interested in that particular subject while you're not, why are you so interested in that particular subject in molecular biology while there's probably other fields of biology?
Yeah, that's a great question, Diamond Goat. So I thought that I was going to be a veterinarian. I grew up with a lot of animals in my home.
Really?
Like many kids like animals, but I had an older brother that brought very exotic animals into the house. We had a great horned owl. We had lots of different types of snakes, not venomous snakes, but many different types of snakes, piranha, squirrel, raccoon, very unusual household. So I had thought that I was going to be a vet because I was so connected to animals. They lived in my home. And then I took a grade 11 biology course where molecular biology was first introduced to me by my grade 11 teacher. And I just fell in love with molecular biology, how the cell works, how DNA controls, the code of life, turns into mRNA, turns into proteins, how DNA transcription occurs, how translation occurs. I just thought it was fascinating that these little molecular engines and these molecular machines were working inside of all of us to make life happen. And I just thought it was cool. And I turned my attention to molecular biology. Then I did my undergrad indeed in molecular and medical genetics at U of T, and my master's and my PhD. I was already a molecular biologist by this point, and consider myself a molecular biologist. I've done a lot of molecular biology, but I also learned stem cell biology during my postdoctoral training, and different types of biology as well that we pursued in my lab, aging biology and CRISPR biology and mRNA science, obviously. So, but all of it starts with molecular biology for me.
So you just said that you did stem cell biology as your postdoc research. So why do you choose that, and what particular thread in the stem cell field were you hoping to follow?
Another good question, Diamond Goat. So I was doing a lot of reading when I was in Finland on different subjects that were not just my own specialized area, although I was focused on many different things in Finland. And it struck me that stem cell biology was emerging as a tractable science that you could really do good experiments on to pursue, questions that were as yet unanswered. And also the intersection was aging biology. So I was also reading a lot on aging biology. And then it occurred to me that, stem cell aging must be important for the aging of organisms, people. And so my thesis was that the aging of the stem cell compartment was going to be important. So when I went to do my postdoc, that's what I wanted to work on. And I found a good lab at Stanford led by Dr. Weissman. And when I went to see him, he said, well, I'd really like you to work on this. And it was something totally that I didn't want to work on. And I said, yeah, but I'd really like to work on this. And then I told him about my ideas for stem cells, aging, DNA damage repair. And he said, sounds great, go for it. So then I started working on that and brought over, after doing 4.5 years at Stanford, then I continued that work as a major focus in my lab at Harvard.
So you're a co-founder of 5 companies, and obviously I said it was Moderna, and some of them are on the stock exchange. Can you talk more about your experience of founding a company, the challenges in front of a serial entrepreneur, how you form companies in seemingly different areas of biology, and how to balance so many different roles, or all of the above?
Yeah, it's another good question. I started to work in my lab. I was a biologist studying basic questions of biology, where if you answer it, it's a previously unknown, so you answer it and it's a great question. But what I realized at some point was that if we ask questions in biology, that if we were to get a good answer for it, that there might be a way to move that towards patient care into the clinic via either big pharma or biotech, what have you. And I realized that was interesting to me, to have what we were working on make some sort of impact on human health. So I started to work on questions in the lab that if we were to answer the questions that we were trying to address, that might there be a possibility to move this towards the clinic. And that was the case with Moderna and the mRNA technology that we developed. And when we were working on CRISPR, to move it towards blood forming stem cells and get CRISPR into the clinic. So that eventually came to pass with the foundation of Intellia Therapeutics for blood cell conditioning for transplantation medicine, which was the basis for forming Magenta Therapeutics, which I co-founded. Again, our work sort of directly, when we answered a question, it could be translated. So that's kind of how the way I thought about it. So I'm interested in working in clinical areas that are unmet. So it has to be an unmet need. I don't like working on things that there's already a very good treatment for. Yes, you could make maybe something that makes more money or something like that. That doesn't interest me at all. I want to work on needs that are great and not yet addressed. And obviously our science has to be tractable towards that issue. There has to be a path forward for the science. You can do some great science, but moving that towards clinical development is not going to happen in our lifetime. So you have to think quite a bit into the future to think about, is the thing that we're doing and working on, is there a path to translate this into a clinical program? So you have to have a sense of that. Yeah, and by the way, once you do it once and you do it once successfully, you learn so much along that journey, and it becomes interesting, and you sort of in a way wish to do it again, because you learn a lot and you meet new people and you meet you gain new expertise. And to be honest, after you've done it a couple of times, then you get very good at it. So you know, it's true of anything that you do many times, you get good at it. So I guess I got good at it, and then sort of helping other people move their ideas towards the clinic as well. One of the companies that several companies now I'm working doing that, but one that I'm leading in Cleveland, Convello Therapeutics, that doesn't have to do with our science at all, but the science of a colleague and a friend who I've known for years. And I thought their science could be moved towards, addressing a big medical need, multiple sclerosis. And indeed, we have programs making our way towards the clinic in that regard.
Okay, so once again, you talked about Convello Therapeutics, your recent company. So what impact do you see Convello Therapeutics having in 10 to 20 years? And what angle does Convello offer in the industry that other companies, biotech companies, don't have?
Yeah, well, again, very good question. So the field of or the illness of multiple sclerosis, you may or may not know, it's an autoimmune disease of the central nervous system where the protective coating on nerves, which is called myelin, it's sort of an insulating wrap, gets unappropriately attacked by one's own immune system. It's autoimmune attack, and it degrades that myelin, which impacts the function of the nerves in the central nervous system, and it's a progressive and devastating disease. And there's over 1 million people in the US that suffer from multiple sclerosis. Well, because it's an autoimmune disease, there are actually 14 FDA-approved therapies that are all directed at modulating the immune attack. But what Convello does, and what is recognized as the next frontier to treat these patients, is to actually regenerate the myelin. So you may be able to stop the immune attack, but you also have to be able to regenerate this insulating coat on the nerves to make them function properly. And so what Convello's focused on doing is using small molecules, where the founding scientists, Dr. Paul Tazar and Drew Adams, discovered that a certain pathway in the cell, that if you inhibit certain enzymes within this pathway, it could stimulate the cells responsible for wrapping the nerve to do it more efficaciously. So the difference between what we're doing and what the pharma industry is doing is we're approaching multiple sclerosis from a remyelination perspective, not a stop the autoimmune attack perspective.
Okay. So what were some difficult or unexpected challenges when you started Moderna?
It's a what the first biotech company you work on, you know little about how it works because you've never been trained in that area. You know the science, obviously, and if you're a scientist, you know the science. But the machinations of the business and how different business people think about what's confidential information, what should be shared, what's not shared. There's lots to be learned. So I would say that there was challenges for learning, like anything new, the new aspects that I hadn't had training in. I wouldn't necessarily call it challenges, but it was obviously new things that one needed to learn. So I learned a lot when I founded that company about how company building happens, how money is deployed, how money's raised, how you think about the vision of a program, how you think about the risk of one area or another area. It's all about risk mitigation. You don't want to have, you don't want to set your bar so high in terms of a risk that if you fail, it dooms your whole program. Rather, you want to set the risk threshold as low as possible, which makes sense. To get your products across the line and into patient health. And you can go for the more risky things later on after you've had success. So these are learnings that I needed to learn, and served me well for subsequent ventures.
And just to add on this question is, was there any funding problems when you started Moderna? Like, once again, I know companies, they need funds to get started on their product. So were there any funding problems?
No, Moderna, first I raised the money myself, the initial funds, but then we got a CEO in place who's still the CEO of the company, and he's very, very good at raising money. So we were always successful in raising money, and raising lots of money. Actually, there was more than $2 billion raised before the company went public, and the vision for the company, if mRNA therapeutics works, it could be applied in so many areas. So that was the vision, and that was that you have to believe in the vision that mRNA is one of the three main molecules of life. DNA makes mRNA, makes protein, makes life and disease, same token. So if you could use one of the key molecules controlling all life, then you had the ability to intervene in many different diseases. And indeed, if you look at the pipeline of Moderna, there's over 24 different products in development, 14 of which have already entered the clinic. And many other mRNA companies are springing up like mushrooms now because of the success of the vaccine programs of Moderna and BioNTech, Pfizer. So I think, mRNA therapeutics is, the idea was to make it a new therapeutic platform, a new therapeutic paradigm. And now it's been proven to be very effective and safe and what a stage, global pandemic, who would imagine that its first debut on such a gigantic stage, but it certainly has.
And then just another question on Moderna. So what would Moderna need to do to become the biggest vaccine company in the next decade?
Well, I don't, I think, well, it has many vaccine products in development. So that's already happening. I don't think it's just vaccines. That Moderna never wanted to just be a vaccine company. mRNA therapeutics are really where, when I found, when I founded the company, the idea, was mRNA therapeutics for genetic disease. DNA mutation makes bad mRNA, makes bad protein, gives you disease X, Y, Z. There's 6,000 genetic diseases. That doesn't include cancer. So I think that mRNA therapeutics, although mRNA vaccines are now a proven paradigm, mRNA therapeutics will be the next frontier, that you have a genetic disease or some other illness that is fixable by expression of a particular protein at a particular time that could be enabled by mRNA. So I really see that as being the future for not just the company, but for the field in general.
So I read that you said that Canada needs to have a biotech hub so they won't have to depend on America's biotech companies. So what key elements are missing in the Canadian biotech ecosystem, and what steps should Canada take to have a successful biotech hub?
Well, it's a big question. So, you can just look to biotech hubs in Boston, Cambridge, or South San Francisco and say, what do those places have, and use that as a model. So the first thing they have is outstanding academic institutions. It starts with that. So Boston, Cambridge has Harvard and MIT, for example. The next thing it has is it had a large amount of space in Cambridge, is the case, that was basically could be sort of repurposed to house biotech and eventually pharma and this and that. So space was a premium in proximity to the system. It had venture money. It had IP capital expertise. It had scientist entrepreneurs that had seen the movie before and done it before. It had anchor companies, big anchor companies that started it, Genzyme and Millennium and Vertex. Then it had big pharma that came, and big pharma built large buildings in Boston, Cambridge. So it's turned into the epicenter of the biotech industry on planet Earth, because it now has all of these things. It has people that have seen the movie before. It has companies that have done it successfully. It's got big companies, it's got skilled workforce, it's got big pharma there looking for the next big thing in biotech. It's a complex story, and it doesn't happen overnight. It's a long-term vision.
Okay, so how is mRNA able to get into multiple cell types, or the entry mechanism into cells in general?
Well, delivery was always going to be the challenge with mRNA. mRNA is a macromolecule, and it's actually a very large macromolecule. It's big. So we could get it into cell, back in 2008, 2009, we could easily get it into cells in a dish because transfection agents, those are the things that move cargo across cell membranes, had been developed. So we could use that. Similarly, when mRNA went in vivo inside animals and people, you needed delivery vehicles. So lipid nanoparticles, for example, which are being used to deliver the mRNA vaccines, those had been in development for decades and were actually used quite readily for another type of RNA therapy called small interfering RNAs, siRNAs, which came about 15 years before the mRNAs. Totally different. It's for inhibiting gene expression. It's not for making proteins. Totally different thing, but it's still a small RNA that you need to get inside of a cell, and lipid nanoparticles are how to do it. So the delivery science has been evolved and evolving for many decades now, and is part of the timing of Moderna was good, and mRNA therapeutics, that we really could take advantage of already decades of delivery experience that had already been sort of developed and could be developed farther to deliver mRNA. And I'm not sure if that exactly answers the question that you asked me, but.
Yeah, that actually does. Thank you. So I just had the Pfizer vaccine as I'm 16 years old. So why are mRNA vaccines but not other non-mRNA vaccines injected into muscles? So does it mean that muscles have advantages over other sites in their body to develop immunity against COVID-19?
No. It's a nice, easy intramuscular injection.
Okay.
And by the way, you've gotten other vaccines in your arm. It's a very, very common place to get your vaccine. You've got your influenza vaccine. I mean, you might have taken a nasal, but typically your influenza is an intramuscular injection. Many of the vaccines that you got when you were an infant, which you don't even remember getting, but you got them as an infant, you got them intramuscularly. It's actually a very, very common route for administration. It's getting it into the body in an easy way. There's immune cells all over our body, not just, they're literally all over the body. You need to get the mRNA expressed. It can be expressed by the local cells at the site of injection, and for those cells to present antigens to the immune system, present whatever it is you're expressing, in this case, the spike protein, to the immune system, for the immune system to systemically kick in and mount an effective immune response.
So I noticed that from the internet, you talk a lot about spike proteins. So what exactly are spike proteins?
So spike proteins, and this is really thanks to the virologists and the field of virology for studying viruses, and coronaviruses in particular. As you know, SARS-CoV-2 is a coronavirus. The reason they're called corona means crown. If you actually look at an electron micrograph of these viruses, they look like they have these little spikes. It's a circle with little spikes coming out of them. It's what gives them the crown-like appearance. And those little spikes are comprised of multiple different proteins, but one of which is the spike protein. And the spike protein is that protein on the surface of coronaviruses that first engages with the human cells to initiate the infectious cycle. So the spike protein interacts with a receptor on human cells called the ACE2 receptor, the ACE2 receptor, and that's actually what initiates the infectious cycle. So imagine now that if that's what initiates the infectious cycle, well, if you could make antibodies that block the ability of the spike protein to engage its human target, which is the ACE2 receptor, you might have the ability to block infection at all from occurring. And so virologists had taught us that the spike protein of this family of coronaviruses. That's how it uses to get into the cell. So it was an obvious and very good target to use to raise the immune alarm against. And so the spike protein is used as the antigen, the immunogenic agent. In the case of mRNA, it encodes the spike protein that is then recognized by the immune system to be the non-self entity that the immune system responds to.
So the obviously, teenagers can now get the COVID-19 vaccines, but the FDA said they've been receiving reports of teenagers with myocarditis. This seems to be more of a concern the younger vaccine recipients are. So are you concerned about some unanticipated effects from the vaccines on kids 2 years old and above?
Yeah, well, it's a good question. And, never say never in biology, and things happen. So with myocarditis, the rate that it's occurring is, I think there's been about 2,000 reported cases, 300 of which are really seem to be linked to the mRNA vaccine. That's 300 out of several 100 million people vaccinated. So, and by the way, it resolves very quickly, and it's not really considered to be a serious health hazard. So I would argue that there's always risk with anything. The risk of getting COVID and getting very sick and potentially dying of COVID, those numbers are very well established because so many hundreds of millions of people have been infected and millions of people have died of COVID. So it's all about assessing risk benefit. And so I think the risk benefit still far outweighs the benefit than the risk, at least with myocarditis that appears to resolve very easily and is not a long-term health concern. Whereas becoming a COVID long hauler is not good. Becoming, having to get on a ventilator and certainly losing one's life from SARS-CoV-2 is obviously not where you want to see any family member end up. So, but it's important, the cool thing is, and what's true is that this is probably going to be the most medically studied intervention in all of human medical history. So millions and eventually billions of people will be vaccinated, billions. There isn't a medical study that large in existence. And I could tell you that the science journals every week, there's dozens and dozens of reports of vaccination in this type of patient, that type of patient, this group of people, that group of people. It's one of the most studied intervention, and it will be the most studied intervention in all of human history. So it's not like we're not paying attention and watching what's going on across the planet with all the people, both getting infection, getting vaccinated, and having complications either from infection or vaccination. This is very, very well studied. And so far, the overwhelming consensus is the risk benefit is definitely in favor of getting vaccinated.
So if someone is vaccinated, why would they be concerned about other people not wearing masks? So wouldn't they be protected? And why would it make sense after vaccination to wear a mask in any situation, inside or outside?
Well, getting vaccinated does not mean that you're absolutely lock stop against getting infected. That's one thing. So what vaccination does is it makes your immune system primed so that when you actually encounter the pathogen out at the grocery store or at the ATM machine or wherever you happen to encounter it, you're still going to get the virus is still going to get in your body and try to infect you. The good thing is your immune system is already readied for it. And so it can probably, and in the reason they work is it blunts the infection very early, doesn't make it so you get any illness at all. You don't shed virus can't replicate. And this is what protection of immunization, getting vaccine provides you. It doesn't mean you don't see the virus. You still get the virus. The virus still get in. You still have the ACE2 receptor, but you've got antibodies and you've got T cells now that are are primed to be able to respond quickly and effectively. So that's an important thing to understand. Also, obviously, the emergence of variants. Vaccines are perfect, or not vaccines, viruses are perfect evolutionary units. They will continue to evolve. We've seen them evolve. The Delta variant, now they're calling it Alpha, Beta, Delta, Gamma. We will go through the whole Greek alphabet, I'm sure, with the number of variants that are set to emerge. And some of these may be more or less effective at getting around the immune response elicited by your vaccination. So we have to be concerned for variants for sure. And I think it's really a measure of how do you as a society know who's vaccinated and who's not vaccinated. There's so much vaccine hesitant people in the US and around the world, but particularly in the US, fueled by political agendas, honestly, largely, that now you go to a shopping mall or whatever it is, and everybody doesn't have a mask on, but half the people are vaccinated, the other half aren't. The half that isn't is carrying a new variant that is pretty good at getting past your initial vaccination. So we're not out of the woods yet. This virus is still running rampant on planet Earth. It's a pathogenic virus. Its evolution is happening as we speak, with new variants that are more infectious, more transmissible, more hopefully not more deadly, but that certainly will come as well. So we need to be on our guard. We also have to start to regain our lifestyle and regain our lives. So, I'm vaccinated, my family's vaccinated. When we go out, to walk our dog or whatever, we don't wear masks. We're outside where it's almost impossible to get a transmission anyhow. But I believe in the power of vaccination to protect oneself and protect, from at least current variants, even the variants that have been tested right now. The vaccines do work against them. They may not work quite as well as the original strain of SARS-CoV-2, but that eventually may change. The virus may really evolve to get past the initial, either if you got an initial infection, so the immune response you have to getting Gen 1 SARS-CoV-2 or Gen 1 SARS-CoV-2 vaccine.
Okay, so you helped pioneer the use of mRNA technology when you were at Harvard. So what are the differences between traditional vaccines and mRNA vaccines? And what mRNA vaccines have been successful before the COVID vaccine?
Well, so vaccination is something that has been in we've been vaccinating, or the origins of vaccination date back to 15th century China, and then Europe in the 18th century. It started to really become a used paradigm. It's one of the most successful things we've done in human history. So typically vaccinations are whole pathogens, so whole viruses that are either inactivated totally so that they're non-infectious, or disabled so that they're not pathogenic, but they're still slightly infectious. So, but the whole idea with vaccination is to introduce a little bit of a pathogen or a whole inactivated pathogen to alert the immune system, to ready the immune system such that when you see the pathogen for real, when you're shopping or you get it from an infected colleague or whatever, now your immune system is ready to go quickly instead of starting from ground zero. So every vaccination, there's two parts, I think, of it. The second part is always the same, which is getting your immune system going and activated to respond to something that is non-self. That's what your immune system does on a daily basis. Your immune system right now is surveilling things that come in to your body to say, is this self? If it's self, I don't want to react to it, because then you'd have an autoimmune disease. If it's non-self, I might want to react to it because it might be a pathogen. So that's what vaccination does. It harnesses this normal process that your body does on a daily basis. And then the front end is, how do you introduce this foreign, this non-self, it's called antigen, this non-self entity to allow the immune system to respond to it. And as I said, traditionally it was done with whole inactivated viruses or attenuated viruses, but we realize that you don't actually have to expose the immune system to, the insides of the virus, because they don't ever, the immune system doesn't see that, because that gets inside the cell upon injection. What you really need is, to respond to the outside of the virus, something that you can quickly get onto and neutralize quickly. So in the case of SARS-CoV-2, the spike protein, if it's not mRNA for expressing the spike protein, some of the companies are just doing the spike protein itself, the purified spike protein, and giving that spike protein to alert the immune system. Others are using adenovirus to deliver the spike protein. Various ways of introducing the spike protein. They're all designed to do the same thing: alert the immune system to a foreign antigen, to ask the immune system to do what it does on a regular basis.
Okay, so many countries have been asking people that it's fine to mix two different COVID vaccines. Do you think this practice is safe or not?
So I'm sorry, I got a little distracted. So mixing vaccines?
Yeah. So let's say someone took a Pfizer and then they took a Moderna.
Yeah. Well, the one thing that we have to say about science is that big studies haven't been done yet where this has been done. I know studies are underway testing this, but so far there's no published data. So that's the first thing. As a scientist, you don't like to speculate on something that there's no data, and I'm of that camp. With that said, I see no reason a priori to believe that if you get vaccinated with one technology for a shot one and another technology for shot two, that should in any way or form be dangerous. It's, again, like I said, it's two front ends delivering the antigen to have your immune system respond to it and do what it does on a regular basis. But big studies on mixing and matching haven't been reported yet, they will be reported. I know in Canada, you're Canadian, I'm Canadian.
Yeah.
These mixing and matching programs are ongoing.
So once again, you said that some argued that mRNA vaccine is not an actual vaccine, but it's a new type of gene therapy. Why would they say it is not a vaccine? Do you agree with that idea?
That mRNA in this context isn't a vaccine?
Yeah, that's what some of the people have said, and it's like a new type of gene therapy.
Yeah, I would not really agree with that. I mean, it's as vaccination, as I laid out to you, is deliver the antigen in some way, shape, or form to allow the immune system to recognize it, have the immune system do what it does. So mRNA in this case is a new way of delivering the antigen and having the antigen presented to the immune system, but the goal is exactly the same as an inactivated virus, as a peptide, a isolated protein, as an adenovirus. All of these are just doing the same thing. So now mRNA is a therapeutic to express a human protein that's missing. That certainly is a new therapeutic paradigm. That's different. Now you're expressing new human proteins. This is, of course, the spike protein. It's not a human protein. It's a viral protein designed to elicit immune response. So, and mRNA therapeutics are in development for sure. In fact, I founded the company based on the promise of mRNA therapeutics. So that I can sort of see them, those statements sort of applying a little bit more to that setting. But it's a new experimental paradigm for sure. It's not brand new. It's not off the shelf. I mean, there's already been many clinical trials that have been run. There hasn't been an approved product because it takes a long time to develop new therapeutic paradigms. And in fact, to be honest, I founded Moderna in 2010, and we already have an emergency authorized approved product 11 years later. That's actually very, very fast for a new therapeutic paradigm to make its way to hundreds of millions of people. That's extremely fast. It's not to say that any of the steps were skipped. None of them went through many clinical trials, and all the clinical trials were done for the COVID-19 vaccines. So yes, it's a new medical paradigm, but and you could argue, I mean, you could call it a genetic therapy or a gene therapy if you like, because DNA makes mRNA, makes protein, makes life. So there's no question that mRNA is the necessary and obligate intermediate between DNA, genes, and protein synthesis. I've never called it gene therapy, but you could if you so wish. Gene therapy is typically associated with DNA-based vectors.
So what other pioneering technologies are you interested in that could change the future landscape of medicine? And once again, I'm not, it's like other ones, not just the mRNA technology.
Sure. Well, CRISPR-Cas9 is interesting, and gene editing approaches, and that's and I've founded one of those companies. There's others out there, and they're making good clinical success. To be honest, they're all in the clinic now. Well, not all, but many are in the clinic, and they're having success. Even CRISPR, or Intellia Therapeutics, company I founded, reported good clinical data last weekend for one of their programs in the liver. That's exciting. Yeah, I mean, who knows what the future holds for science? You know, really big breakthrough stuff happens about once in a decade. First, it was small interfering RNAs. That was a big changer. You know, small hairpin RNAs to knock down gene expression. Then it was mRNA. Then it was CRISPR. Now mRNA certainly, you know, captivated the spotlight for everybody. And even CRISPR is using mRNA to express one of the key elements of CRISPR, which is Cas9. But yeah, you know, get out your crystal ball, Diamond Goat, and see what's coming down the pike and see what's coming next.
So what advice did you receive during your career that shaped your career or success?
Well, I don't know if I can articulate it per se, but obviously pursuit in science that you're passionate about. And, you know, so the job of a scientist is to unveil previously unknown truths. It's the job of a scientist. That's why I find the attack on science quite distressing in the US, led by the political right, you know, to attack science, although the job of the science is really it's truth telling. It really is in its purest form. That's what science is. So yeah, I mean, just, you know, pursue good quality science and make sure, you know, a good scientist will do their darndest to prove themselves wrong. That's the job of a science. You make a hypothesis, you have a bit of data that looks interesting, and you try to think of as many ways as possible to show that the conclusion that you are drawing from that data is actually incorrect. So you're always trying to poke holes in your own data. That's what scientists do. They try to poke holes in their own data and their own conclusions. And when you've tried everything possible to poke a hole and you don't find any holes, then you publish your data with confidence and you say, I feel confident that I can say that this does this with this outcome in biology. That's pure science. That's how science works. That's how it should work. And that's, to my mind, unassailable.
Okay, so what advice would you give to students who want to pursue biology or biotech?
Well, it's a great career. You know, you work with smart people, so you know, you should, you know, it's not for everybody. I mean, in science, you know, you have to deal with a lot of failure. So, you know, 9 out of 10 of your experiments don't work or don't give you the answer that you thought, or the, you know, so you have to, you know, if you have a 10% or a 20% hit rate of having success in science, that's very good. So you have to have a thick skin. You have to be persistent. You have to be very creative, actually. It's a very, very creative occupation. You know, people think of the arts as being creative, which obviously they are, but science is extremely creative. You have to be creative to do good science. So if you have a good creative mind and you have the the willpower to work long hours, lots of days in a row, and, you know, in the pursuit of the unknown and revealing something about the unknown, then it's a great career to go into.
Okay, so that was the last question. So once again, thank you, Dr. Rossi, for being part of my podcast and giving me the opportunity to interview you so teenagers and the general public can know more about mRNA vaccine technologies in the field of bioengineering. So once again, thank you.
Yeah, well, nice job, and I appreciate your mission to help educate young people. So hopefully you get a lot of people tuning in to listen.